YouTube page. The communications team would be taking some screenshots as the speakers speak. There is also interpretation services for those who are going to be listening in French. So you can click on the French channel to listen in French or the English channel to listen in English. To start this meeting, I'll call on the manager of the Women's Rights Unit, Mrs. Matilda Lesako Buko, to open the meeting for us. Matilda, over to you.
Thank you very much, Henrietta, for starting us off. Good afternoon, good morning, depending on where you are joining us from. My name is Matilda Laseko-Poko. I'm the Women's Rights Unit Manager at the Center for Human Rights at the University of Pretoria. We commissioned the research that was conducted by Thandi Tlhabane that is being launched in this event. Before we proceed, we would just like to recognize the presence of the Honorable Commissioner Mandenga from the African Commission on Human and People's Rights as a member of the working group on the rights of persons with disabilities and older persons within the African Commission. Thank you for honoring our invitation, and we look forward to your opening remarks. We would also like to welcome Thandi Tlhabane, our researcher who put in quite a bit of work in the project and will share some of her insights with us. The report will be available online following this launch. In addition to those, I thank everyone who's been able to join us online for the webinar and those who continue to stream in. We welcome comments at the appropriate time in the program, and also during the live chat, you're free to put in your comments or questions, which will be attended to in due course. Right, so in the absence of Professor Franz Verneum, who seems to be just running a little bit late from a previous meeting, we at the center got engaged with the older persons work as we started working on advocating for the ratification of the Older Persons Protocol, which is a protocol of the African Union, protocol to the African Charter, specific to the rights of older persons. While the treaty itself is specific to older persons and not in a gender-specific way, the project sits with the Women's Rights Unit, particularly because of the universally recognized gendered impact or gendered vulnerability of older women to the rights abuses, as opposed to older people as a vulnerable group. So in that sense, the work sits in our unit. And while we advocate for the ratification of the Older Persons Protocol broadly for the benefit of all genders, the women's specific work sits squarely within our mandate. It's in this regard that following the COVID pandemic and witnessing the human rights violations that came about in that period, questions were being asked among the women's rights movement about how do we build better and how do we prepare better for similar pandemics going forward. And to that extent, we took the time to think about how can we document what issues arose specific to this vulnerable group of people in this period, in such a way that when in the future, whether it's a similar pandemic or COVID again, because there were different waves of COVID, and we realized lessons learned in the first wave were not being taken into account in whatever measures governments were putting in place in second wave reactions or second wave or third wave policies. And so we decided it's an important thing for us to be able to document some of the gendered impact of the policies themselves, to the extent that they have negative consequences for older women, or whether or not they are taken into account in formulation of those policies by their member states, by their governments, and also instances where measures that may seem positive or for their benefit, in actual fact, then have a negative consequence for older women. And so that is what this research report contains. And we'll have a session later on where Tandy will speak a little bit more about her findings and her recommendations. For now, I want to thank you for your attendance, and again, extend an invitation for you to put in your comments in the chat and engage with us in the question and answer session. All right. So with that, I'll hand over to our moderator, Henrietta, to introduce the next speaker, Commissioner, for his opening remarks. Henrietta.
Thank you very much, Matilda, for that. So now we're moving over to Commissioner Mulford, who is the Vice Chairperson of the Working Group of Experts on Older Persons and Persons with Disabilities at the African Commission on Human and People's Rights. The Commissioner will be speaking to us about older persons' rights and a bit about the project. Over to you, Commissioner.
Yeah, thank you, moderator. And good morning, everybody. The consultant for this particular study, as well as the program manager and the project officer of the Center for Human Rights at the University of Pretoria. May I simply say, dear participants and ladies and gentlemen, it is an honor for the working group on the rights of older persons and persons with disabilities in Africa to attend and preside at this launch webinar of the report on the impact of COVID-19 on older women in Southern Africa. It is also with honor that on behalf of the African Commission on Human and People's Rights, and especially on behalf of the working group on the rights of older persons and persons with disabilities in Africa, of which I am, as you have heard, the vice chairperson, and on my own behalf, that I address my appreciations to the Center for Human Rights for holding this important webinar. And at the same time, for extending an invitation to the African Commission to attend this launch. Ladies and gentlemen, from the outset, I would like to thank the University of Pretoria, the Center for Human Rights, for the usual support and active involvement in the promotion and protection of human rights on our continent. I would furthermore like to express my congratulations towards you, the University of Pretoria, the Center for Human Rights, for successfully organizing this webinar, which I believe is going to be a success. Of course, with the aim that the report on the impact of COVID-19 on older women in Southern Africa be launched. This report is welcome in many ways. Indeed, in a context of the usual vulnerability of older persons, it is important to remember that COVID-19 pandemic has greatly weakened the living conditions of this group of people, as well as the effectiveness of their rights. We must admit that the COVID-19 pandemic posed peculiar challenges to the protection and promotion of human rights globally, including the African region. The direct impacts on the enjoyment of socio-economic rights, such as the right to health, livelihood, and attainment of the highest standard of living, is almost apparent. The pandemic also greatly impacted the mortality rates of the global populace, especially older persons, who by virtue of age have a lower immunity to diseases and other deadly viruses. Beyond the direct casualties and deaths, disease, economic consequences of lockdowns and other control measures, the pandemic has been instrumental in revealing the underlying systemic inequalities that are the consequences of long-term exclusion of certain groups from human rights protection. Therefore, the documentation of this impact is important to inform engagement with the specific duty bearers in the course of the pandemic and to support accountability efforts post the pandemic, as well as to facilitate learning on responses to emergencies in the future. There is also growing evidence that the socio-economic impact of the pandemic has had a disproportionately negative effect on certain social groups as compared to others. Gender representation is the hardest hit job levels, the disruptions of systems of care for families and limited access to social protection has meant loss of income, increased vulnerability to abuse, and increased exposure to ill health. Through this webinar, the Center for Human Rights will provide us an opportunity to share the findings of the study and to gain inputs from stakeholders relevant to the protection of the rights of older persons in Africa. Dear participants, ladies and gentlemen, your participation in this webinar is tangible proof not only of your interest in the thematic, but also of your involvement in guaranteeing the rights of older persons in Africa. In view of the objectives fixed by the Center for Human Rights, I therefore urge you to participate actively in this webinar. I also invite you to make contributions that will be very useful to exploit as the world emerges from this COVID-19 pandemic. Dear participants, ladies and gentlemen, I'll be failing in my duties if I do not express my appreciation to the project manager, the project officers, and the technical partners of the Center for Human Rights for their support to the availability of this report. With these few words, ladies and gentlemen, I wish us all to have a successful launch of the report on the impact of COVID-19 on the older women in Southern Africa. I thank you most sincerely for your kind attention, and I take this opportunity, and the rare one at that, to declare this webinar open. Thank you.
Thank you very much, Honorable Commissioner. Thank you for those beautiful opening remarks. Now we're going to hear from the lead consultant on this project, Ms. Tandy Halbana, who will be speaking to us for the next 15 minutes about the key findings of this report, the key findings of the research and the way forward. Over to you, Ms. Tandy.
Thank you very much, Henrietta, and thank you also for this opportunity that University of Pretoria and you entrusted me in, and I really appreciate that. Please do allow me to share my screen so that I can share my presentation.
Okay, 1 second.
Okay. But while she's doing that, I should just indicate that this was basically a desk review that was assigned to me to look at the 3 different countries. Is that okay?
Yes, you can.
Let me see. Okay, let's see. Oh, yes, I see that. Wait. Let me see. Yes. Let me know if you can see my screen now.
Yes, we can. Thank you.
Oh, fantastic. All right, I was just simply saying that this was a desk review that I had opportunity to actually research a bit on the different countries and how COVID-19 might have impacted on elderly women, but also what the government responses were for those specific countries. Just a little bit of background, and I might speak to some of the issues that the commissioner has alluded to already, so do pardon me, but we just have to recognize that with COVID-19 pandemic, there were new and peculiar challenges to the protection and promotion of human rights. And specifically, we had direct impacts on the enjoyment of socio-economic rights, such as the right to health and livelihoods. And we also realized that with the epidemic, underlying systemic inequalities were also revealed. And these included long-term exclusion of certain groups from human rights protection, especially older women in our case here. And specifically, we want to say that gender representation in the hardest hit job levels, the disruption of systems of care for families, and limited access to social protection meant loss of income, increased vulnerability, and increased exposure to ill health. So why older women? We recognize that there has been general increased life expectancy in Africa, with South Africa, Zambia, and Malawi representing some of the highest life expectancy levels of 64 years. But we also recognize that there is what we call feminization of aging, where we have a larger proportion of the older population being women themselves. And this coupled with feminization of poverty, where we are very much aware that there's a disproportionate amount of the world's poor who are women. And this is a legacy of patriarchy in many of our countries. And therefore, this intersecting and accumulated disadvantage faced by women across their life course compromise their quality of life in later life. So longevity increased, unfortunately, in an environment where public, legal, policy, programs, and systems were not ready. We are not ready as a region to be able to address sufficiently older persons' needs and, of course, observe their rights. So we do have competing social protection issues such as HIV, such as endemic poverty, such as unemployment. We have high youth unemployment in the region. And so COVID-19 added on this pressure and the limited national resources, and indeed, it also took precedence. So a lot of research that was conducted also highlighted violation of human rights of elderly women, specifically during the pandemic. A meta-analysis that was conducted in 28 countries with 52 studies estimated that about 16% of elderly experienced abuse. And this abuse included physical, sexual abuse, psychological abuse, as well as emotional abuse. It also included financial and material abuse, where elderly persons' monies and their assets were taken away from them. It also included abandonment. If you recall that long-term separation of families, not being able to move and see your own, abandonment, neglect, and of course, serious loss of dignity and respect for older persons. However, only 1 in 24 cases of elderly abuse are reported. So we recognize as well that this is not even scratching the surface. So what was this report trying to achieve? So the objectives included to establish the form of government responses to the epidemic in the region, to evaluate the extent to which measures and policies adopted targeted or included older women as part of a marginalized and vulnerable group. Also to ascertain the gaps in the national social policies and government responses, including how the gaps impacted or continue to impact on the rights of older women. To specify how government responses to COVID-19 pandemic and impact of COVID-19 contributed to either uplifting or violating older women's human rights, and to come up with relevant recommendations on how the gaps in the government responses adopted can be mitigated in the future in order to include older women in government responses. All right, study sites, as we've said, we're talking about South Africa, with Lesotho, Zimbabwe, Malawi, and Zambia, looking specifically at older women. So we looked at various frameworks that have been used to try and advance the rights of older women. And we looked at the regional ones, and we recognize regionally we have protocol to the African Charter on Human and People's Rights on the rights of older persons. And only Lesotho and Malawi ratified these. But however, we highlight that Article 9, Section 1 assures the protection of the rights of older women from violence, sexual abuse, discrimination, and based on gender. So we do right there recognize already, given the experiences of COVID-19, we have failed on that one. We also have the protocol to the African Charter on Human and People's Rights on the rights of women in Africa. Now, this one is specific. This Maputo protocol is specific to the women themselves, so older women themselves. And Article 2, Section 1 specifies that the state parties shall combat all forms of discrimination against women through appropriate legislative, institutional, and other measures. And then we do have the African Charter on Human and People's Rights, and then the SADC Protocol on Gender and Development. Having said that, we do have other global frameworks that we also looked into just to understand women, older women's rights, and this included UN Sustainable Development Goals, the Madrid International Plan of Action on Aging, the United Nations Universal Declaration on Human Rights. Different countries we recognize within our study do also have some frameworks, but those that were a bit more specific to older women included South Africa, the Older Persons Act of 2006. Lesotho has the National Policy for Older Women that came into place in 2015. So you can see that South Africa was a bit early amongst all these countries in recognizing older persons' rights. And then we have Zimbabwe in 2012 Older Persons Act. We have Malawi's National Policy on Older Persons 2016, and Zambia is reviewing its own policy at the moment. What were the government responses to COVID-19 that affected older women? There were first and foremost that hit all of us was restrictions of movement. Restrictions of movement meant limited access to health services for older persons and other basic amenities. And this was a basic health rights threat for especially the chronically ill, because aging comes with chronic ailment. And then we have limitations to, older women had limitation to exercise active aging. We know that this is very much encouraged, that they should still be very active. And we are also recognized, because of the complex living arrangements within our region, that older women are usually the heads of many households taking care of children, vulnerable children and orphans. And so they are still very much active, but the lockdown meant that they could not. And they're active normally in the informal sector. So the lockdown meant that they could not continue with their active aging, and that simply meant that they were thrown into poverty and hunger. But we recognize as well that the government, different governments in the different countries, and I didn't do specific given the time, what each specific country did given the time, but that's in the report. But different countries also tried to assist specifically to older women, while others were not necessarily specific. Generally, we had cash transfers that were a bit general. For a country like Lesotho, cash transfer increased pensions for older women at the time, older persons at the time, which means the older women were included in that. But
sorry,
we also,
Sandy, sorry to interrupt. Your slides aren't moving.
Where are you right now?
Still on the first page. I thought it was from my end, but I see that.
Oh, you are kidding me. Okay, let me try and do this one, because this is where I am right now. But I'm happy to share the slides as well. Can you see this one right now, COVID responses?
Yes, COVID-19 responses. Yes, we can. Thank you.
Okay, I really apologize. I don't know why, but I'm happy to share these, Henrietta, for circulation afterwards.
Perfect. Thank you very much. I appreciate that.
All right, thanks. So I was just simply saying, just to maybe retract a little bit and say, the first response that all the governments did was basically lockdown. And this meant restriction on movements. And restriction of movement meant specifically for older women, limited access to health services and other basic amenities. And that threatened their health, because we know that aging comes with chronic ailment. So their right to health services was very much affected immediately there. And then we also limited restrictions on movement also meant that they could not work. So we are aware that a lot of older women are taking care of orphans and vulnerable children. And with high youth unemployment, they're also taking care of a lot of households. They are heading a lot of households. So they are active, they are still very much active, specifically in the informal sectors. And so that meant that limitation in their movement meant that they could not work, which threw them into poverty and hunger. The government also tried to actually include money in to support elderly women. And please do understand that there was nothing that was said specific to elderly women. They were put in a box with other elderly persons, and also in some cases with other vulnerable populations. So there was nothing that was specific to say elderly women. And we are arguing that it's important to target elderly women because of a lot of other things, which include the burden of care. But anyway, they received cash transfers, and some were general, some were targeted at older persons. So the general ones meant that, yes, the governments are trying to assist everyone who was vulnerable at the time. But vulnerability, even at the time, varied. The targeted ones, older women got money. For example, in Lesotho, older women got money, and other older persons also got money. But what that meant is, in a system where they seemed to be the only ones with money, that kind of threatened them, because they were the only ones when everybody else was out of work. It put them at risk than everyone else. And women, older women being vulnerable, that exacerbated their vulnerability. There were delayed transfers of these cash transfers, and that meant for a long time, some would go without food or any form of support. Mobile banking was introduced in some places, and that meant this was something novel for elderly persons. And that meant a very complex system to operate, and they had to rely on other members to support, albeit the risk of theft. And then there was increased dependency on older women, which also meant that this kind of violated financial security of older persons because everyone else was out of work and they were receiving money. This meant that communities and families now dependent more on this stream of support that's only coming to this particular age group. And like I said earlier, that this also increased their abuse because that meant the money was demanded from them nicely, but in many cases, as I indicated earlier, there was a lot of abuse. They were physically abused. They were raped for their money. There were cases and reports of grandchildren killing their grandparents, grandmothers specifically. There hadn't been any cases that I came across of older men that were killed. Older women were killed for their money. This means high risk that was put on older women. And also another important one was the elderly were then becoming caregivers, not care recipients. They were becoming caregivers for other household members that were not working. But we are also very much aware that as it is in our systems, they are already caregivers for children and orphans. So they became caregivers and not care recipients, which violated their right to care. All right, so what is the report generally recommending? We're recommending that the governments should roll out responses that target older women as an explicit vulnerable group. So lumping them as older people, we see that as a discrimination in itself. We need to improve policy and multi-sectoral coordination mechanisms to coordinate issues of older women with clear responses to older women and support the systemic rights-based long-term care systems. There's need for strict implementation of COVID protocols, especially at the beginning of each wave. And this requires investment in policing and innovative communication and community or grassroots engagement strategies. And all of these should include the older women themselves in the decision-making. We need to improve access to reliable information and participation of older women. They need to be very much aware of the epidemic and what the implications are for them. There is need for more funding to social care programs for elderly women. There is also need for innovative cash transfer strategies that are easily accessible while also protecting older women. We need to be able to collect sex disaggregated data to understand the gender differentiated impacts of COVID-19, because as it is, we have no idea. Like I said, this was a desk review. So at country level, there is need to actually collect that information and be able to disaggregate so that we have clear understanding of the impacts. And this should not just be quantitative data. We also need to be able to get in-depth understanding of the impacts on older women. We need to develop safe spaces for older people, older women, where they can voice their issues. I mean, there are a lot of talks about safe spaces for girls. I think it's important that we recognize that older women are also a vulnerable group that requires safe spaces so that they can voice their issues that are specific to them, so that we're able to attend to them and be able to meet their rights. And there is also need for mobilization and support of civil society-based and community-based initiatives to empower older women. We also call for mobilization of full ratification of and implementation of Maputo Protocol by other member states, it's nice to have these reports, but when we are not implementing, that's not very useful. And therefore, the last one there, we are recommending periodical reports on the achievement of member states in the implementation of this protocol. I hope I was good with time. And that's about generally it, just a summary of what the report entails. Thank you very, very much. I just thought we should just highlight that part of this, when we talk about the rights of older persons, we've been talking about a decade of healthy aging at this time, and we need to be able to recognize that not recognizing the rights of older women will be failing in achieving a decade of healthy aging. Thank you very much. Over to you, Henrietta.
Thank you very much, Tandy. You can stop sharing your screen now. Thank you very much for that wonderful presentation. It was very detailed. Thank you. Now we are going to go to a discussion session for 15 minutes with Matilda, where she would ask you some questions from the report for better understanding. And just a reminder to our participants, please feel free to post your questions in the Q&A box, because after this session, we're going to read out your comments for the consultant as well. Over to you, Matilda.
Thank you, Henrietta. Thank you, Tandy. That was quite a comprehensive summary of a very detailed report you were able to generate, answering literally all of our research questions. And I'm sure participants will agree when they get a chance to look at it. We just wanted to take about 10 minutes to highlight or speak a little bit more about some of the recommendations that you've made. Each of them is equally important, but given that we have this platform, we just wanted to create a bit more knowledge and awareness about some of the content of the recommendations. So I will just take about 15 minutes to get your reflection on the recommendation around social care systems and programs and the need for member states to invest more in that. We'd just like to get from your research and from your experience, what are some of the examples of countries where we can look to for best practice? What are some of the measures that are required for a member state to have an adequate social care system?
Okay. Oh, sorry. Oh, my bad, I pressed the wrong button. All right, thanks for that. Matilda, I think the first one is, what is key in terms of social care systems is that a lot of our policies, South Africa included, a lot of the policies that have been put forward in the 5 countries is emphasis on community-based care, so community and family-based care. And so in terms of care services, the recommendation is still trying to support families, households, and communities to be able to care for older persons. I think that would be the big recommendation. So how do we then support families and communities to care for older persons? We could be able to capacitate families to be able to do that. If we have high unemployment, that is so systemic in our country, it means that instead of trying to support and care for older persons, families are failing in that role because now there's a higher dependency on the limited pensions in some cases that the older persons are being assisted. So when we say and celebrate that we are doing very well in the region with some countries offering, for example, South Africa, very lucrative pensions compared to other countries to older persons. But because that money is distributed so thinly across the household and across households, you support the children and your children in your household, but you also support your other children and relatives outside your household. So we need to be able to capacitate families and households and communities generally to be able to do that. That would be the big one. And then often alternative care is the second best option. And alternative care means that having care homes. But we know that a lot of studies have shown that even just mentally, that impacts on older persons because we are putting them in spaces that they are not used to. So the issues relating to dementia, because this is a new space, that kind of exacerbates that. So the recommendation would be supporting families, households, and communities.
Yes, thank you. I think that gives a little bit more information for a policymaker and NGO thinking about what kinds of interventions should they craft around this particular recommendation. I think the other big one which has come up in your discussion is the need for sex disaggregated data. I raise it particularly because it's something the working group on persons with disabilities and older persons is trying to address with their own sort of projects. I would just like maybe to get your sense of why you think this still remains a challenge within our governments, bearing in mind the research you've done in the 5 countries, and perhaps a reflection on some of the measures states can put in place in their systems so that, you know, this process of collecting this data doesn't seem like it's an extra thing in addition to what they are already doing for the greater part of the population.
Okay, all right. I mean, there's data that normally we collect through censuses and surveys on older, that includes older persons. There are studies now that are being conducted to actually collect data that is specific on older persons and their experiences. And so I think studies like that will be very helpful because then we'll be able to actually say older men have their specific experiences and older women have their specific experiences. So we need to be able to tap into that so that if we want to be effective in our programming and policy, because if we just lump them as just older persons, we are failing to actually address the specific needs of older women. And maybe I should say older men as well, because they are different. Recognizing specifically that all of these 5 countries, and Malawi, even with their matriarchal system, older women in Malawi are still more disadvantaged than older men in Malawi. So we recognize that the systems, the legacy of patriarchy still continues to actually disadvantage older women. And we need to be able to tap into that and understand specifically what those issues are. And we cannot do that if we're just talking older persons.
Yes. So I hear there that where I see Commissioner's hand is up for comment.
And Matilda, let me include that these data that I'm recommending we collect should both be quantitative in terms of just getting an understanding that the spread, but details will only be able to get into through qualitative, and qualitative takes longer, but we need to be able to collect detailed information to get clear experiences of older women. Thank you.
Okay. I just have one more point that I'd like you to give more information on, but I will have to give the floor to Commissioner Mudford first. Commissioner, go ahead.
Thank you very much. Well, I want to thank the presenter. I think there was quite a lot of work that went into the study that was carried out. And I think the recommendations that you have made are very important. And it's my hope that the states to whom we are directing those recommendations are going to act on them. But I wanted to find out, we are talking about older women, but have we got something about older women who are also disabled? if there is anything specific about them, because I think the fact that they are old and then the fact that they are disabled also requires, I think, additional attention. Thank you.
Thank you very much, Commissioner, for that particular one. Yes, we do recognize that there are multiple tiers in terms of when categories even within older women. And I definitely do agree with you that we need not also just look at older women as a box. We also need to disaggregate that so that we are able to tap into specific ones. And yes, disabled older persons, older women also just means double the vulnerability, and we need to be able to unpick that. So I agree with you that we need that, and a lot of policies were not very specific about disability and older women, and so that's something we really need to look into. There are disability policies that kind of are separate. There's just a small allusion to older women who are disabled, but we have not, as a region, we have failed to be specific into how do we address older women that are living with disability. I always try to get this one wrong in terms of, do we say disabled, living with disability? I think it's the right one, right? Matilda, you're muted.
Okay, let me take you away from that
Yeah.
so that we can wrap up our session. We've got, I think, 1 minute left. I think the last one is, for the Women's Rights Unit, we are really doubling our efforts to try bring the older persons protocol into force. And it currently has 6 signatories and requires 15 for it to have binding effect on member states. Of the countries we've researched, 2 of them have ratified it, Lesotho and Malawi. And so I just wanted to see from your reflections in doing the work, if you found that there was any sort of influence in the extent to which the measures they put in place were guided by standards set in this kind of treaty document.
Okay. Thank you very much, Matilda. And usually when we look closely and when we try to unpack why Lesotho, why Malawi, why just these 2, and we're thinking a big country like South Africa that kind of started early on issues of older persons, and these would have gone. But and then that was also a big question that I had in terms of when I was trying to communicate and interview people. And the understanding was sometimes in Lesotho and Malawi, the push was not coming necessarily from internally. The push is usually from outsiders. And so Malawi specifically, a lot of funding on that for the cash transfers that was given to older persons was coming from outside, was not necessarily from the government. And so the agenda, it was very much influenced by the international community. And so I think we need to be able to own up and have the capacity to own this. So I think when we do recognize that as a region, as countries, we own these protocols enough, we'll be able to do that. And so I think like I was saying, that as member states, I think we need to be, because we need to be able to push and influence ourselves a little bit more, and to be able to monitor and maybe try and even understand why some member countries are failing to recognize it. Is there something that, is it about resources, or is it something that's not necessarily a priority within their countries? So that also is a problem, because if older people's rights are not a priority, and yet we are seeing 7% in terms of representation of proportion of the total population, that undermines them, and that is a discrimination factor. So I think I would say maybe in just some countries, they don't necessarily see it as a priority. And Lesotho and Malawi, maybe the influence has been very much influence from outside, that they've been able to rectify this.
All right, Tandy, thank you so much. I think we just have limited time, whereas we could go into each of the recommendations because each has got particular detail to it, as informed by the research, but also as informed by your knowledge and experience as an expert in the rights of older persons. So we thank you for the great work in the report. And look forward to engaging you further on it in implementing the recommendations, whether as the Center for Human Rights on our own or in partnership with any of the organizations that we work with on the rights of older persons. So thank you very much. I think we'll make the report available online and we'll take comments as we get them, and I hope we can continue to engage you with the work.
Thank you very much, Matilda.
Thank you. Henrietta?
Yes, thank you very much, Matilda and Tandy, for that discussion session. I'm just going to read out the questions from the Q&A box. There are 3 questions here. The first is asking if the research focused on women in residential facilities. I have the answer to that, which is no. The second is interesting finding, Tandy. I'm curious to know if you found anything related to risk associated with older women's social isolation / loneliness resulting from movement restriction during the COVID-19. And the other question here is, would you consider that we may also have to include older women in a disaster response plan? Over to you, Tandy, to respond to these questions. Thank you.
Thank you very much, Henrietta, for those, and thank you for all your questions. Yes, the first one, risk due to isolation. That I tried to highlight, and I realized that was at the time when you were not all seeing the slides. So I'm happy to share that. But that was one key area, that there were a lot of abuse that older persons experienced because of the lockdown and therefore isolation. Some had to stay by themselves for a very long time without being checked by family members, and therefore that meant more vulnerability to neighbors and community members that recognized that they were not in there, that they were not having enough support. So definitely yes. And then the second one was, do we need to include them in? Do we need to include older women as part of response to disasters? Absolutely, absolutely. And like I was trying to make a case, we need to be able to recognize the different categories, and older women as a special category that is at risk. We need to be, that is already very vulnerable, needs to be attended to as a specific category. Yes, so I do agree with that. I don't know, I think I responded to that, Henrietta.
Yes, let me see if there's another. So South Africa has over 1 million older persons. From your perspective, is the government doing enough to plan for the growing number of older persons?
Like I was saying earlier, South Africa, a lot of us, when we're doing the research, the understanding was that I'll find South Africa being the model. But we recognize that South Africa fails to be a model because it is a very stratified society. Racially, there are specific racial groups that are completely, I would argue, that tend to be covered much better than others in the growing numbers, in the planning for the growing numbers. But the majority, which is the Africans, are not. And that's why we're calling for community and family support, that for us to be able to support and older persons and plan better. So if communities and families are strong enough, and you get this in a lot of research, families are still happy to take care of their own, but they're just unable. Older persons themselves, they are happy to stay in their own communities and families because they still feel responsible in a way that I can still take care of my grandchildren, but they're also taking care of me. So that family connection is still very key to them. But we need to be able to capacitate families and communities to do that.
Okay, thank you very much for that response. I'm not sure if there are other people who still have questions. That was all in the chat box. So if you have questions, please put them up, or you can raise your hand and you will have the floor. We still have, this session was supposed to last till 1:10, but it seems that participants are reserving their questions for when they see the reports. Okay, in the absence of further questions, thank you very much, Tandy. We appreciate the work you did on this. It was very rich, the report, and thank you also for availing yourself for the presentation here. Okay, I see a hand raised. I'm going to allow Zain make a contribution.
Good afternoon, and thanks for the report. An excellent report. I'm Zain Bobulia from the Office of the Premier Gauteng, also responsible for older persons. Zain,
we can no longer hear you. Did we lose you there, Zain? Please unmute. Okay. I take it that there is a possible internet or connection issue on Zain's part. Zain, you can send your comment to the Q&A box and we'll take it from there. We have our Assistant Director with us, Dr. Nkata Murungi, who will give us the vote of thanks, but we're just going to go back to the Commission, to Honorable Commissioner Muford, to give us some remarks before we close the meeting with our Director. Thank you very much. Thank you, Tandy, again. Yes, looking forward to the slides so we can share it with the participants as well. Over to you, Commissioner Muford.
Thank you very much, moderator. The Deputy Director for the Center, the consultant, the program manager, and the projects officer, and indeed the participants, and may I simply say, ladies and gentlemen. I am indeed pleased on behalf of the working group on the rights of older persons and persons with disabilities in Africa to be able to participate in the launch of this webinar on the report on the impact of COVID-19 on older women in Southern Africa. On behalf of the African Commission, and particularly the working group on the rights of older persons and persons with disabilities, I would like to renew my appreciations to the Center for Human Rights for giving us this opportunity to go through the report on the impact of COVID-19 on older persons. Director, the members of staff of the center, please receive our sincere thanks for the efforts that you have put in to make sure that this report is available, and also the coordination that you have showed in organizing this webinar. To the participants, my thanks also go to you for taking time off your busy schedules to come and attend this launch, which I believe is going to be a launching pad for a very important report, which we expect that other states are going to take a cue from and implement the recommendations which are contained in the particular report. Ladies and gentlemen, I am convinced that this launch is a launch which, from the look of things, has been successful, because we have heard from the presenter about what work went into the report and its our fervent belief that it is going to be a useful tool for us in the promotion and the protection of human rights for the older persons. Lastly, but not the least, may I thank you most sincerely for having made it to this particular launch, and I look forward to future engagements. Thank you very much.
Thank you very much, Honorable Commissioner. We will now go to our director, actually, Professor Franz, to close the meeting for us. Professor Franz, over to you.
Hello. Yes.
We don't have video.
Yes, good afternoon. And if there's no video, I'm not sure, but just from my side, thank you so much to our Women's Rights Unit team in the Center for Human Rights, who has been so professional and okay. So, good afternoon. I try again. I'm here with the Assistant Director, Dr. Murungi. And just from my side to say thank you very much to the Women's Rights Unit of the Center for Human Rights that have been so diligent and professional in putting this together. I think for us as a center, this is also part of honoring the International Day for Older Persons on the 1st of October every year. And I think in Africa, we can never have an event, and at the center, we always remind ourselves that as opposed to the United Nations context, where there is no binding treaty, in Africa, we actually have a treaty, the protocol to the African Charter on the Rights of Older Persons. But at the same time, we also know that that treaty, that protocol, is not yet in force. It requires only 15 of the AU member states of the state parties to the African Charter to ratify it, to ensure its entry into force. So we hope that this event, this focus on women in the context of COVID-19, older persons in the first place, but also how that has been feminized, how women are particularly affected. We hope that this will be another moment where people see the usefulness also of the protocol. If we look at the provisions of the protocol on older persons, it speaks to these issues that we have been discussing today. So it's again an appeal to everyone on the call who has any capacity, any role that they can play in advancing the process towards a fuller ratification of the protocol on the rights of older persons. But in terms of this event, once again, thank you to participants who were with us this day, the consultant who worked on this, the women's rights team, and also Commissioner Mwandenga. Thank you very much for your kind words, but also for driving this process forward from the side of the working group. So maybe I ask Dr. Murungi to say just a short last word, but from our side, we wish you all a good afternoon or a further continuation of this day. And we trust that this report will really serve the purpose for which it has been prepared. Thank you so much.
Thank you, Franz. I think I will not really keep us any longer because I know that the time has run over. Just to say, just to reiterate, thanks very much to the team and to the consultant and the commission for the opportunity to contribute to this. I think, as has been said severally, it's part of a wider agenda. It can only be the beginning, and we are hoping that we have the opportunity to at least expand this study beyond Southern Africa, as was done in this report. So we look forward to seeing all of you joining the seminar, the webinar today, and to engage further on the report. Thank you very much. I think we hand it back to Matilda.
And maybe just as we do, we can also just remember, I do remember to say thank you to our donor, GIZ. I'm sure perhaps in the course of the event we've mentioned that, but we always, at the end of an event, think what we have accomplished would also not have been possible without the material support of the GIZ in this particular instance. So thank you very much.
Okay, thank you very much. Matilda, do you want to say any final words? No? Okay, thank you very much everyone for joining in. Thank you to the consultants, the commissioner, interpreters, the participants, and very big thank you to the communications team that worked behind the scenes to make this possible. I wish you all a beautiful day. And yes, the slides are available. I'll share them via email to everyone the link was sent to, and the reports will be uploaded on the center's website. So watch that space. Thank you very much. Do enjoy the rest of